You know, being in pediatric critical care, some of the heart defects we see in babies are absolutely wild. We had to go pick up a baby the other day with a congenital heart defect. We call these our CI babies. This heart defect was called DILV, dual inlet or double inlet left ventricle. In double inlet left ventricle, the right ventricle and the left ventricle are reversed. And so we have this big, ginormous left ventricle on the right side of the heart and essentially a non-functional right ventricle on the left side of the heart. And then the right atrium and the left atrium both feed into that ginormous left ventricle. But wait, there's more. The aorta and the pulmonary artery are also reversed. And so the aorta is coming out of this non-functional right ventricle, and the pulmonary artery is coming out of this big, ginormous left ventricle that just happens to be on the right side. And this kid is suffering from aortic atresia, so the aortic valve is non-functional. So even if there was some function to that small right ventricle, it wouldn't be able to get through the aortic valve. But this kid's lucky in that this patient has a ventricular septal defect, and so there's blood flow between the two ventricles, and they have an atrial septal defect, and so there's blood flow between both atria that actually allows some oxygenation there where there wasn't very good oxygenation to begin with. These kids can be really, really sick. This kid was doing fantastic. This kid was actually on room air, although if this kid were to get really, really excited, there would be a whole bunch of pressure changes that could cause his oxygen to just tank. But the way we treat this is we administer prostaglandins. Prostaglandins opens up that connection between the aorta and pulmonary artery, which is the ductus arteriosus. That starts closing when babies are born, and we keep it open with prostaglandins to allow blood mixture between those two major arteries. And this kid will undergo a bunch of surgeries and hopefully have a good outcome.